Thanks, Anthony. I'm Alice, Cakebread. I'm from Children's Hospital in Michigan in the Hemophilia Treatment Center. And I have with me today, Ellen.
I'm Ellen Kachalsky. I'm the social worker for the Adult Hemophilia Treatment Center at Henry Ford Hospital in Detroit.
Okay, and today we are talking about coping during and after COVID. And so I just wanted to start by saying congratulations, you've made it this far in the pandemic. It's been extremely stressful and emotional in physical and emotional ways. And it's been a whole year now since March hit that COVID's been in the United States, and that's a long time to think about it. And I just wanted to make sure that we hold space for this year and how it's been a huge adjustment. And we've all had to adapt in different ways and change our schedules, our lives, everything like that, our work. And I just wanted to give a quick intro with that and say that we're going to go over what COVID's been like in your life and everybody's lives, and how to kind of cope through it and cope after it, because hopefully soon we will be at the after.
Okay, so as you can see, this is some pandemic data from the Center for Disease Control, and it shows the impact of the COVID illnesses and the hospitalization rates and the death rates that are certainly impacted by race and ethnicity. And it's been very unequal.
And as Ellen had mentioned before in the last slide, there's been quite a bit of different racial disparities with COVID. Already there was racial disparities that existed in healthcare systems before the pandemic hit, but it just kind of made it worse. So it disproportionately affects Black people and people of color. And there's just this term that I wanted to mention that I'm sure many people are already aware of, called weathering, which I'm just going to kind of read it off right now, which is the advanced aging caused by bodily wear and tear from fight or flight responses to external stresses, especially racial discrimination. So this is kind of over the years, having racial discrimination, racist insults, little microaggressions over time, or macroaggressions that kind of over the time give you cortisol responses and kind of ages you in a way. So that has been linked to cardiovascular disease as well as diabetes. And those two conditions have definitely been linked and associated with kind of the beginning research in the pandemic of an elevated risk of not just COVID, but severe COVID. So I just really wanted to highlight that racial disparities already were in healthcare systems, and COVID kind of exacerbated it as well. And even that could mean with care, healthcare professionals, not feeling like you're being listened to or getting the proper care that you need as well. And so this slide is about more pandemic data, just general pandemic data, related though to people with bleeding disorders. So we wanted to throw in some studies related to people with bleeding disorders as it relates to you or people you know or care about. So generally they stated that 71% of people with a bleeding disorder or who were a caregiver of someone with a bleeding disorder were very worried. 71% were worried about getting COVID. And I thought this was also an interesting statistic. 19% worried about being able to get the treatment product, whether that be Factor or other treatment. And we actually, at least in my clinic, had quite a few people call and ask or were worried about ordering their Factor earlier because they were worried about not being able to receive it. So that's another stressor that people with bleeding disorders or chronic conditions have to worry about, is getting their medication on top of worrying about getting sick. So like it states that bleeding disorder patients have more worries, it seems like, and caregivers of people, so usually children, their parents or caregivers have significantly more concerns about getting COVID or being able to get their treatment product.
Interestingly, about that point, I think in many of the adult treatment centers, we actually saw a decrease in patients getting Factor, probably because of less activity. people were really restricted in terms of where they could go. Many were staying home, especially at the beginning,
Yeah.
before venturing out. So we were seeing a decline in factor orders.
Yeah, we actually had a few parents call up and say they didn't want to order because kids weren't going to school as much, so there wasn't as much of a risk. But so we had to learn as well as a center kind of how to talk about these things because it was all new. So generally, we're going to go through the ages and the lifespan as we talk about COVID and how it's affected everybody. And we're going to start with children. So a big impact on kids has been the lack of socialization and virtual schooling. So not being in person, not being able to even physical contact like sports or hanging out with friends or giving hugs, not having any of that growing up. And then being behind a computer screen all day, kids are stuck in the same spot having to virtually learn, which has been safe, but at the same time, kids have lost kind of that peer interaction, especially younger kids. And the attention span I've had reported from lots of families has been very hard to keep kids focused on a computer screen all day long. And it's been hard for them to keep them paying attention. And then there's been having to address fear and anxiety in children, not knowing the appropriate way to explain COVID to kids without scaring them too much, but also teaching them to keep space and keep cleanliness and whatnot. So that's also been something, and kids asking a lot of questions like, what is this? What does this mean? Or if anybody has lost someone close to them, explaining that to a child as well generally is hard. And then on top of having the pandemic has been even harder. And one thing I've noticed a lot of people reaching out to me about is school concerns, especially children who have special needs or IEPs or 504 plans, not having them accommodated appropriately for what they need. And they've been kind of lost in the school system while school's trying to adapt, of course, but I know a lot of people aren't getting, or children aren't getting the needs met that they need. Okay. We have the impact on adolescents and youth now, so teenagers. This is really looking at what teenagers have gone through the pandemic, which has been in a lot of news articles and a lot of studies have come out about this. So the biggest thing is lack of socialization as well, like we saw in children, but with teens, that's those are your years to make connections and make friends and enjoy hanging out, and that has been kind of cut off. And then just not having friends available to hang out with outside of school. So you're having to be at a computer screen all day and then not be able to see your friends or contact them the way you would or see them in person. And it's definitely different over a computer screen or FaceTime than it is seeing your friends. So losing that peer contact and support has been really hard. As well as just generally, I know a lot of my juniors and seniors that I've talked to are really struggling with future plans like college, trade school, jobs. The uncertainty of the future has been even impacted even more than it already was with the pandemic. So worrying about what the next year is going to look like. And just general fear. It's COVID is scary and it's been a scary topic. So I think having that fear of getting COVID, family members getting COVID, friends getting COVID, those sort of things, it's impacted at all levels. And then just general, a lot of, if you're already struggling or haven't been, but already struggling with anxiety, depression, and your supports have been cut off, like sports, outside activities, friends, those things have been cut off, and you already have anxiety or depression, or even if you don't, that's been heightened in some people because you've lost your support. So suicide rates have gone up, anxiety and depression have gone up. I know in the article that's linked below, a New York Times article, there was a big increase in teens going to the emergency room for mental health crises. And oftentimes people are sent home without a lot of follow-up care with psychology support, and that's virtual too. So I know that's been hard for people to deal with the virtual aspect of therapy. But we've just included crisis line numbers in the suicide hotline, of course, because this time right now has been especially hard, especially for teenagers.
And additionally, there has been spiking of substance abuse and alcohol and opioids, and that's been significant over the course of this COVID pandemic as well.
Absolutely. In the emergency room, often it's comorbid or comes along with people who are showing up with anxiety and depression, and suicidal ideation is substance abuse. So absolutely.
The other thing too is that with more people requesting therapy, the therapists have been overloaded trying to increase their availability virtually. So again, the lack of in-person therapy has been problematic.
Yeah, absolutely. It seems like psychologists all over the place have been completely booked up, and there's not appointments until months out, which, if you're in a crisis situation, is too long. Okay. And as we're moving through youth to teenagers, we're going to kind of look at the family unit as a whole as well. So the impact on families has been huge, and there's a lot of dynamics you're working with, right? There's kids, parents, grandparents, families all look different. But generally, there's a lot of different people, and everybody has their own individual struggles, as well as the family unit as a whole struggles. I know there's been a lot of reports of struggling at work and home life balance, especially if you're working from home. You just walk to your living room and or your kitchen, and then there's your work as well. So keeping that balance has been hard. And then for a lot of families, they were still working in person through the whole pandemic. So that comes kind of childcare concerns. There's been a lot of childcare concerns of families that had to work through the pandemic, but their schools are virtual. And I know there's been a lot of grandparents helping, but if you don't have that support, it's been extremely hard to work through the pandemic as well. And unemployment struggles have been huge, trying to work through the system and navigate it. You can't talk to a person. So it's been very hard, I know, for a lot of families with unemployment. And which leads into financial concerns, losing jobs, being underemployed, applying for unemployment. It's been rough, and to lose your job is upsetting and difficult. You don't expect that. It also, a couple other reports of caregiver burnout of parents that have been home with their kids this entire time has been a big struggle, because you're having to take care of your kids all the time, which is great to some degree, but at the same time, everybody needs a break sometime. So that's been a big concern. And one that has been really interesting and pointed out a lot is co-parenting struggles. If you're not with your partner, or you live in different households, navigating quarantining wise, healthcare wise, safety wise, going over to the other person's house, or just generally navigating different ways you co-parent, and the extra stresses that COVID has put on that. And then again, school concerns, having parents having to address that by themselves has been hard. And then general isolation as a family unit, or trying to figure out what to do as a family unit, has been very hard.
Additionally, there's been documentation that this kind of isolated yet togetherness had the potential to increase neglect and abuse from both sides, because it's been so difficult to keep track of those, where maybe in schools and in work situations, those children and teens would have been monitored, and, at least there would have been some outside people looking in on what's going on. Okay, so now we're kind of transitioning a little bit to the adults who have faced many similar issues in terms of the lack of social and physical contact if they were living alone, single. I know from many people, if they couldn't get out to socialize or date or do physical activities that they used to do before. And then certainly the financial impact if they lost a job, and trying to make sure that they were able to get unemployment. I heard a number of patients struggle with trying to get that, because trying to get through the unemployment phone was so difficult. And even though they added it was all phone, you couldn't go into the office, and so they had to wait and call at midnight, and so that was an additional stress for adults trying to maintain some level of financial independence, or at least being able to cover bills for food, rent, clothing, all the normal expenses of living. And again, if they lost their job, the uncertainty of whether they were going to be able to return to a job, or this was actually, basically a termination in a job where they didn't know if they were going back. Restaurants, stopped serving in the restaurant. And unless they had a way to serve patients for pickups and delivery, we lost restaurants, we lost service industry people. And so that became a whole other issue. And this was particularly a problem in the hospitality and hotel and tourism industry. There are a number of cities in the United States that gear up for hospitality. Take a look at Florida with Disney World, Orlando, Las Vegas. And so tons of people lost their jobs working in the hotels and in the hospitality industry. Relatively unscathed were those that work in governmental jobs, tech jobs. Places like Amazon were adding jobs because they were able to increase shipping, and people were, of course, ordering more online and by phone. So if you were tech-based or you had a job that was able to do that and make that pivot, it made it easier. But again, the impact on the loss of jobs was particularly hard on African American and Hispanic and other minorities. And certainly, this was frustrating. They didn't know when they were going to go back. Hotels didn't know when they were going to be able to open again, and whether restaurants and hotels, even at not full capacity, whether they'd be able to survive. And so you had this cascading feature of job loss and possible future unemployment. And, what am I going to do for the rest of my life? So that became significant. And it's going to be a wait and see game in terms of what's going to come back and how much things are going to come back.
I think too, just like we had mentioned before, navigating underemployment too, that you could report unemployment was so hard. And I know there was a period of time where they were making everybody re-verify. And I know there was a lot of gaps between what people needed in the moment now versus what was actually being given out. So I know unemployment was stalled by weeks and weeks, and then people needed help now, sort of. Issues were really big, even now through the pandemic, have been an issue.
And the other thing that impacted this was if you lost your job and couldn't afford to stay where you were, even though there was a moratorium on evictions, if you couldn't afford it, you still owed it. You just had a deferment on that. And whether you were going to be able to, for example, move back in with family so that you could combine forces and at least have some source of support.
And I know some people who, even though they were saying there was an eviction moratorium, they were still putting people through eviction court, but holding those evictions until the moratorium was lifted, which is very stressful to lose your housing and have to figure that out while not having an income.
So for our more mature adults, our older and our seniors, again, lack of physical contact with sons and daughters and grandchildren became increasingly stressful. When you think about it over the lifespan, you have generations, and then when you lose that contact because people are afraid to go out and afraid they're going to transmit COVID virus to vulnerable adults, and older adults, then these people were basically totally isolated and then relying on others to get their shopping done. If you lived in senior living, they locked you down. They didn't allow visitors. If you lived in with a family group, then that was different. At least you had something there. But it was increasingly difficult because a lot of our seniors don't really use electronic communication. They may know how to use their phone, but not all the features. They may not have full access to the web or know how to use those things like Zoom or GoToMeeting and all the other ways that the rest of us use in work or get used to using. And so that's opened a whole new problem for the seniors. And even though they were used to be the largest group learning these techniques, the sophistication in terms of how these things have changed, especially during the pandemic, for almost everything, for business, ordering electronically, that became something that they had to learn to do, and it was increasingly hard for them.
I think on top of what you've said too is the discourse, the conversations in the beginning or the over the summer, especially during the pandemic, about well, I'm young, I'm not worried about it, we should just get over it, sort of thing. I know was a big concern with people who were at the biggest risk for COVID. Was I'm a person as well. And I know that that was a really big impact on mature adults, was the discourse around I'm frustrated with not being able to go out, not being able to do things, and then in turn it leading to, well, you're a mature adult anyway. Sort of discourse was, I know, very hurtful and concerning.
And the other piece of that too is everybody's sensitivity level was different. So there were people that would totally isolate themselves, and there were other people that would go out and eat over the summer outside at a restaurant that had a patio, you know. So everybody's comfort level with how you adapt yourself to this pandemic and wearing masks and isolating, limiting when you go to the grocery store if you don't have somebody else to do that for you, just added other layers of barriers. So
Absolutely. And if you even have the ability for those things, if you have to work, you have to work. You know, if you have to get food for your family multiple times a week, you have to. You know, there's definitely a degree of privilege if you're able to be home and get your groceries delivered and not have to work. You know, there's definitely been a different pandemic for everyone, depending on your privilege and what you've been able to do or be able to have done, you know.
and so sometimes what happened was communities would band together and try and help out their adults and their vulnerable people, churches, hospitals. I know in my hospital, in the cancer center, um, we started delivering meals to vulnerable patients twice a week for like 2 months. Um, and so that was the hospital's effort, and there were other organizations trying to help reduce the isolation and yet decrease the risk of exposure. So, but it
Yeah.
depended on where you were.
It does, it does. And it seems like too, there was a lot of good stories that came out of some parts of COVID as well, of people banding together, people helping neighbors, people trying to volunteer and help in ways that they could, which is also been, I think, a little bit of a silver lining during all of this as well.
Yeah, some of the good that came out. So along with that, for most ages, difficulties with sleeping, if you're not doing your normal activities, um, your energy level is different, your focus is different. And for some folks that left problems with getting to sleep, staying asleep, waking up early. If you're not feeling safe, you might have some bodily symptoms, you pay attention to the headaches and to the other things and to your mood, which was not necessarily your normal. And so people started to focus on these things, and then you'd start this spiral of worry. Is this going to be how I am? What's wrong with me? And yet this was kind of the response to a bizarre situation in this pandemic. So we previously mentioned the substance abuse disorders and the rises we saw in that. And then, at the beginning, people would go to supermarkets and there was no toilet paper, there was no sanitizer. So this kind of fear of, will I be able to get the items I need even at the beginning? And then fights broke out in places about people wearing masks and not masks. So this led to a whole constellation of areas that led to potential conflict. And then the misinformation that came out, and then scapegoating of groups. And we're still seeing that. I mean, look what's happened in the last couple of weeks with shootings, of Asian women, and even the Black Lives Matter. And some of this just seems to grow worse with the pandemic, um, and that's a potential problem. That doesn't necessarily mean we're coming together when we should. So we need to kind of keep an eye on these things, and together as groups start to like minimize the fear, reduce the conflict, and kind of look at fact and science.
It seems too, there's been a lot of different ways. I was thinking too in the last slide with anxiety. I know that for a lot of people being at home, if you're at home, just thinking on the same thought and perseverating and thinking and thinking and thinking. Anxiety, I know, has been a big factor in COVID, and just having that much time all the time to yourself if you have that experience. So otherwise, anxiety, if you're busy all the time working a bunch of shifts, trying to keep afloat, that anxiety can also lead through. And then there's been reports of dysfunctional eating. So eating by stress, definitely emotional eating. Yes, all of us. I think there was a report that said everybody's gained about 2 pounds a month.
The COVID-19, yes.
So that, and then, or not even being able to eat from feeling so anxious, or not even having access to food as well, being able to get good food or nutrient food. And then being emotionally dysregulated, which can cause tension, especially if you're in a family or at work or at home. We have a lot more emotional dysregulation right now. We're living in crazy times with the pandemic. And I think we need to remind ourselves and be kind to ourselves sometimes that this is unprecedented and been really hard, which can also lead into not catastrophizing. It is really hard right now, but kind of thinking of how there will be an end at some point, and we're on a good track, and there's some good things we can do ourselves, thinking, reshaping our thoughts, those sort of things, and trying to really put it into perspective of what you do have control over and what you letting go of what you don't have control over.
Exactly. Sometimes it takes a step back and count to 10 to kind of say, is this really the worst thing that can happen? Or, am I just jumping to a conclusion? Is it really like that? And sometimes you need to do that step back and do a reality check.
I think it feels like everybody's on edge right now too, even especially people driving in my experience. But it feels like everybody's a little on edge right now with the pandemic. Every emotion kind of feels more amplified, which for a lot of people is a new sensation of having all your emotions amplified.
So I thought I'd bring into this something that folks can actually proceed to do later. So this is Sapien Labs, which conducted research on 8 English-speaking countries, so 49,000 adults. That's a significant number. It's like the US, Canada, India, England, Australia, I think, and a couple of others. And here are the data. 57% experienced some COVID-19 related adversity or trauma, and about 25%, a quarter of everybody that responded, showed clinical signs of depression or anxiety, or were at risk for a mood disorder. And that's not surprising in the pandemic. Actually, I'm kind of surprised some of that's not higher, but you can we have the link there if you want to just do it on your own. It takes about 10 minutes, maybe. You answer a number of questions and you get a score. And it's kind of something a little interesting and concrete. It's not like your typical, who's the president test, what day is it, what year is it? But it kind of looks at several different areas that I think are significant. So it's kind of a tool that you can take away and just print out and just kind of have available.
I think too, having that score, having some idea of where your mental well-being is also kind of sometimes the first step, like an objective tool that shows you this is where you look like you're at. And, sometimes that can be the first step to seeking help or therapy or talking to someone, even if it's family or friends, being able to get out how you're feeling if you it's just a good way to look at where you're at.
And I think also realize that we're not alone. With this number of people, this is a significant number of people who've taken these tests. And actually, I think they did this in 2014 and 2018. So this just shows the progression over time and then during the pandemic. So there's a huge amount of data there. And so they give you some ideas about what to look at. So kind of a good little tool. So along with that are some ways to cope, and they're pointed out in some of this in terms of what are our emotions? Are they sad, melancholy, or depressed? And what do you do about that? Well, there are some techniques that you can use if those are kind of the emotions you're feeling. You want to do something slow and soothing. If you're restless, you're angry, you want to do something faster like dancing or cleaning or something that takes energy and uses it constructively. And if you're anxious, there are things like breathing exercises, humor, laughing. Those are all good little techniques that people can use.
I like the one too that says about limiting kind of media intake, which I think is also helpful. I know screen time is up, so social media time, Facebook, Twitter, Snapchat, and then also just general news. You're getting bombarded all the time with information, which obviously it's good to be up to date on what's going on, but I think it can also kind of increase worry and agitation and kind of be upsetting as well. And seeing all of this all the time can be overwhelming on top of how you're already feeling.
Yes, it's a stimulation overload. And, I think particularly in this past year with both politics and elections and a pandemic, that's something that we needed to kind of dial back on. And of course, that's probably why people were subscribing more to Netflix, watching more movies. If there was no place to go, you were going to go watch a movie with, your family or friends if you could be with them or on your own. So
Yes, definitely have binge watched many shows.
kind of a distraction technique. Yeah.
Yeah, absolutely. I think board games were on the rise as well, which is kind of fun to see again. People doing more DIY crafts and whatnot.
Yep. And online poker and card games. Yeah.
Yeah.
So, with all of these emotions having flown back and forth all year, what are our worries? How do we think about ourselves? What are we self-critical about? And is that helpful? Some questions to think about. What thoughts do we allow to hold us back, push us around, or bring us down? And how do we take steps? If you can recognize this, then you can take steps to kind of modify your thinking and kind of what we call reframe everything, so that we don't get stuck in the moment and in the rut. It's been difficult enough. We want to start being a little bit more positive and make some positive changes. And while there's healthy skepticism, there's probably healthy optimism as well. And so this is what we can do. What have you done? What can you focus on? What hobbies and interests do you have that can distract you and take the place of things that you can't do, and maybe decrease some of the worries and negative emotions that we're all feeling at this time?
I liked the area that talks about what we're struggling with or what we're feeling or what sensations we're experiencing, especially the part about what emotions we're ignoring or fighting. I think it's protective sometimes to kind of suppress some ways we feel, but it is really important to work through what we feel and why it's coming up, or why we feel angry, or why we feel upset or sad. Being able to talk about those or voice them and say, you know what, I'm upset right now and I don't know why, or this is why, or just being able to verbalize that can really be helpful.
I think anger is something that many people are afraid of, but it's not something to be afraid of. It's something to take a look at constructively and see if you can pinpoint what the triggers are for that. So I think for many people, anger means that they feel like they're being manipulated or they're not in control. And so that's something I think we need to think about. It's what you do with your anger. So it's an important emotion and it tells us something. tells us about how we interact with the world and what we're thinking. So again, you know, in addition to how we've always dealt with things, what problems has COVID-19 caused in your life? And then how do these problems keep you from being your best self? And sometimes people do that by talking with others, you know, to figure that out. Sometimes people journal and write out a summary of the problem and then say, oh, you know, let's go back to this and, you know, here's what I can do about it. So there are frequently ways through this. So
Yeah, there's definitely many options that you can go through of maybe journaling, like you had said, writing it down for yourself, or to be able to go back through and look at how you felt through the pandemic or how you felt generally. And then also the option to write it down and talk to people about it or talk to your friends and family. There's many different options to kind of problem solve and see what's causing you concern.
So, and with that, we have some things that are good for self-care, some of which you've seen before. Um, you know, there's exercise, relaxation, and stress reduction. You know, I think people have seen all these items written down before, sleep hygiene, but it becomes even a little bit more important in terms of how we deal with a pandemic and isolation and feelings of uncertainty for the future, you know, and what we can do to kind of minimize that or alter it. And so we can do some things like use humor, journal. If you don't want to write, if you have a cell phone, you can do a voice memo and it will transcribe. Scheduling fun activities or focusing on something you can do now or learn now. I mean, those are all important things that allow you to focus on something rather than just kind of ruminating and letting those negative emotions sit and saying, I don't have time for this. I'm angry. I want to get out. Well, if you can't, or you're just starting to get out, there are other things you can do to kind of be a little bit more healthy. And that includes nutrition, walking. People have been outside walking, you know, as weather is getting better. And, you know, talking to others, even if you can't do it in person. We actually have the tools to do that, and they're available to many, if not all people. Most people seem to have cell phones. So, you know, text, call, Zoom if you know how to Zoom or learn how to do it. But there are ways around it, even if they're not what we're used to, we can kind of use these to adapt. And it's all about adaptation.
Absolutely. And knowing you're not alone, everybody is, I think, struggling right now. And like Ellen had said, self-care right now is more important than ever. And even if it's just opening the window and getting some sunshine or taking a break for yourself for a minute, if you can, and just taking a breath, talking to others. I know routine is really big sometimes right now, feeling like you have some control over what's going on for yourself. And sometimes self care could be screaming in a pillow, you know, just getting it out for a minute, you know. This has been stressful. So sometimes whatever works for you in a healthy way can be a good self care activity.
And the more we learn about being outside in nature, it reduces blood pressure. It's good for your heart. And, you know, even being outside and walking in the parks is really good for you. There are smells and things that you just don't get at home, you know, if you're isolated and shut up. You know, the leaves, the smell of the earth, and all of those are kind of healing.
Absolutely. Even if it's just rolling down your window in the car sometimes,
Yeah.
that breath of fresh air can be nice.
Yep. So exercise, I'll say a little short thing about exercise. So we know there's a lot of research that exercise impacts your emotions and it increases your immune system. It helps it function better. And those two things can increase your serotonin levels. Those are the chemicals that make your body and your mind feel better. So there's always an emotional benefit to, as well as a physical benefit to exercise. And it doesn't matter if you don't do it for an hour, 3 days a week. It can be a 10-minute walk. It can be even actually thinking about exercise, you know, taking a quick break is beneficial. in brief spurts. So what do we do as this starts to lift and more people are getting vaccinated? I mean, again, this can be anxiety provoking, because if you've been isolated or limiting where you go and you're getting vaccinated, you still don't know if everybody else is vaccinated yet. There are suggestions for that. You take it slow, kind of keep your routine, but then start working up slowly to things that you're comfortable doing, and just be tolerant of yourself and others, and take care of yourself. Let's wait and see where this goes, and we'll get there eventually. We may have some setbacks, but we'll get there.
And that's the best thing you could do, is be optimistic to some degree, and take it slow, like you had mentioned, Ellen. Just like you had said, be kind to yourself.
Yeah, and it really has to do with everybody's comfort level. So,
Oh, absolutely. And everybody's comfort levels are so different going into this, and different experiences during the pandemic. I know some people who have lost people, that it's very hard to get back out there and kind of not have that anxiety all the time. Or if you haven't, and COVID hasn't been present in your life, you want to get back out there. And even if it has, I know everybody's itching to get back out there to some degree. But there's definitely going to be anxiety that goes along with that. And we just want to thank you, and definitely enjoy the rest of SpringFest. Thank you for coming to see us talk about COVID, and then how it impacts you. And then we'll be answering any questions that you have to the best of our abilities.